Good morning, friends. We are studying male reproductive system. Today we will study about the duct system, accessory sex glands, supporting structure, and ejaculation. The syllabus for BMS first year is Physiology of male and female reproductive system, description of ovulation, spermatogenesis, oogenesis, and menstrual cycle. We are studying male reproductive system. We have seen spermatogenesis. Now, today we learn about duct system, the necessary sex glands. Duct system, there are some ducts in the testes. Next part of the duct system is epididymis. Next to epididymis is ductus deferens, which is also called as vas deferens. Then ejaculatory duct. Now, duct of the testes. Pressure generated by the fluid secreted by Sertoli cells pushes sperm and fluid along the lumen of the seminiferous tubules and then into the series of very short duct called straight tubules. The straight tubules lead to a network of the duct in the testes called rete testes. Now, from the rete testes, sperm move into a series of coiled efferent duct in the epididymis that empty into the single tube called ductus epididymis. From rete testes, sperm move into the series of coiled efferent duct in the epididymis that empty into the single tube called ductus epididymis. Now, epididymis. Epididymis is a comma-shaped organ about 4 centimeters long that lies along the posterior border of each testis. Plural is epididymids. Each epididymis consists mostly of the tightly called ductus epididymis. The efferent duct from the testes join the ductus epididymis at the larger superior portion of the epididymis called head. The body of the narrow mid portion and epididymis and the tail is the smaller inferior portion. That means epididymis के 3 part होते हैं, head, body और tail. At its distal end, the tail of the epididymis continues as the ductus deferens. इसी को vas deferens भी कहते हैं. The ductus epididymis would measure about 6 meters in length if it were stretched out. It is lined with the pseudostratified columnar epithelium and encircled by the layer of smooth muscles. The free surface of the columnar cell contains stercoli, long branching microvilli that increase surface area for the reabsorption of the degenerated sperm. Functionally, the epididymis is site of sperm maturation, the process by which sperm acquired motility and the ability to fertilize an ovum. This occurs over a period of about 14 days. The epididymis also stores sperm during sexual arousal, help propel sperm into the ductus or vas deferens by peristaltic contraction of its smooth muscle. Sperm may remain in storage in the epididymis for up to the several months. Any stored sperm that are not ejaculated by the time are eventually phagocytized and reabsorbed. Now, vas deferens. Next coil is vas deferens or ductus deferens. Within the tail of the epididymis, the ductus epididymis become less convoluted and its diameter increases. Beyond this point, the duct is referred to as the ductus deferens or vas deferens. The ductus deferens, which is about 45 centimeters long, ascends along the posterior border of the epididymis through the spermatic cord to the point in the lower abdominal wall, where it passes through the inguinal canal to enter the pelvic cavity. There it loops over the ureter and passes over the side and down the posterior surface of the urinary bladder. Now, dilated terminal portion of the ductus deferens is known as ampulla. The mucosa of the ductus deferens consists of the pseudostratified columnar epithelium and lamina propria made up by the areolar connective tissue. The muscular composed of the three layers muscularis. The inner and outer layers are longitudinal and middle layer is circular. Functionally, ductus deferens conveys sperm during the sexual arousal from the epididymis toward the urethra by peristaltic contraction of the muscular port. Like epididymis, the ductus deferens also can store sperm for several months. Any stored sperm that are not ejaculated by the time are eventually reabsorbed. Now, next part is ejaculatory duct. Each ejaculatory duct is about 2 centimeters long and is formed by the union of the duct from the seminal vesicle and the ampulla of the ductus deferens. The short ejaculatory duct form just superior to the base of superior portion of the prostate and pass inferiorly and anteriorly through the prostate. They terminate in the prostatic urethra where they eject sperm and seminal vesicle secretions just before the release of semen from the urethra to the exterior. Now urethra. In male, the urethra is shared terminal duct of the reproductive and urinary system. It serves as a passageway for both semen and urine. About 20 centimeters long, it passes through the prostate, the deep muscle of the perineum and the penis, and is subdivided into three parts: prostatic urethra, membranous urethra, and spongy urethra. These are the three parts of the urethra. The prostatic urethra is 2 to 3 centimeters long and passes through the prostate. As this duct continues inferiorly, it passes through the deep muscle of the perineum where it is known as the membranous urethra. The membranous urethra is about 1 centimeter in length. As this duct passes through the corpus spongiosum of the penis, it is known as the spongy urethra, which is about 15 to 20 centimeters long. The spongy urethra ends at the external urethral orifice. Now spermatocord has also role here. The spermatocord is a supporting structure of the male reproductive system that ascend out of the scrotum. The spermatocord and ilioinguinal nerve pass through the inguinal canal and oblique passageway in the anterior abdominal wall just superior and parallel to the medial half of the inguinal ligament. The canal, which is about 4 to 5 centimeters long, originates at the deep inguinal ring, a slit-like opening in the aponeurosis of the transverse abdominal muscle, and canal ends at the superficial inguinal ring, somewhat triangular opening in the aponeurosis of the external oblique muscle. In females, round ligament of the uterus and ilioinguinal nerve passes through the inguinal canal. The term varicocele refers to the swelling in the scrotum due to varicosities in the veins that drain the testes. It usually disappears when person lie down and typically does not require any treatment. Now we will see about the accessory sex glands. The duct of the male reproductive system store and transports sperm cells, but the accessory sex glands secrete most of the liquid portion of the semen. The accessory sex glands include seminal vesicle, prostate gland, and bulbourethral gland. First, seminal vesicle. The paired seminal vesicle or seminal glands are convoluted pouch-like structures about 5 centimeters in length, lying posterior to and at the base of the urinary bladder anterior to the rectum. Through the seminal vesicle duct, they secrete an alkaline viscous fluid that contains fructose, a monosaccharide sugar, prostaglandins, and clotting proteins, unlike these found in the blood. These clotting proteins are different than the clotting protein present in the blood. The alkaline nature of the fluid helps to neutralize the acidic environment of the male urethra and female reproductive tract that otherwise would inactivate and kill sperm. The fructose is used for the production of ATP by sperm. Then prostaglandin contribute to the sperm motility and viability and may also stimulate muscular contraction within the female reproductive tract. The clotting protein helps semen coagulate after ejaculation. Fluid secreted by the seminal vesicle normally continues. About 60% constitutes about 60% of the volume of semen. Next gland is prostate gland. The prostate is a single donut-shaped gland about the size of ping pong ball. It measures about 4 centimeters from side to side, about 3 centimeters from top to bottom, and 2 centimeters from front to back. It is inferior to the urinary bladder and surround the prostatic urethra. The prostate slowly increases in size from birth to the puberty and then expand rapidly. The size attained by age 30 typically remains stable until about age 45, when further enlargement may occur. The prostate secretes milky, slight acidic fluid pH about 6.5 that contains several substances. Citric acid in prostatic fluid is used by sperm for ATP production. Several proteolytic enzymes such as the prostate-specific antigen, pepsinogen, lysozyme, amylase, hyaluronidase eventually break down the clotting protein from the seminal vesicle. The function of acid phosphatase secreted by prostate is not known so far. Seminoplasmin in prostatic fluid is an antibiotic that can destroy bacteria. Seminoplasmin may help decrease the number of naturally occurring bacteria in the semen and in lower female reproductive tract. Secretions of the prostate enter the prostatic urethra through many prostatic ducts. Prostatic secretion makes up about 25% of the volume of semen and contribute to sperm motility and sperm viability. Third glands are bulbourethral gland. The paired bulbourethral gland or Cowper's gland, each about the size of pea, lie inferior to the prostate on either side of the membranous urethra. Within the deep muscle of the perineum, their duct open into the spongy urethra. During sexual arousal, the bulbourethral gland secrete an alkaline substance that protects the passing sperm, neutralizing acid from the urine in the urethra. At the same time, bulbourethral glands secrete mucus that lubricate the end of the penis and lining of the urethra, thereby decreasing the number of sperm damaged during the ejaculation. Some males release a drop or two of the mucus upon sexual arousal and erection. The fluid does not contain sperm cells. Now, semen, जिसको आयुर्वेद में शुक्र धातु कहा गया है, ये शुक्र धातु क्या होता है? Basically, what is semen? What are the content of the semen? In our clinical practice, many times we advise patient to go for the semen examination or semen analysis, particularly in the case of infertility. Semen is a mixture of sperm and seminal fluid, a liquid that consists of the secretions of the seminiferous tubules, seminal vesicles, prostate and bulbourethral gland. The volume of the semen in a typical ejaculation is 2.5 to 5 ml, with sperm count 50 to 150 million sperms per milliliter of the semen. A male whose sperm count fall below 20 millions per ml is likely to be infertile. The very large number is required for the successful fertilization because only tiny fraction ever reach the secondary oocyte. Despite slight acidity of the prostatic fluid, semen has slightly acidic alkaline pH of 7.2 to 7.7 due to higher pH and larger volume of the fluid from the seminal vesicle. The prostatic secretion gives semen milky appearance and fluid from the seminal vesicle bulbourethral glands gives its sticky consistency. Seminal fluid provides sperm with transportation medium, nutrients, and protection from the hostile acidic environment of the male urethra and the female vagina. Once ejaculated, liquid semen coagulates within 5 minutes due to the pressure of clotting proteins from the seminal vesicles. The functional role of the semen coagulation is not known, but the proteins involved are different from that cause the blood coagulation. After 10 to 20 minutes, semen reliquefies because prostate-specific antigen and other proteolytic enzyme produced by the prostatic breakdown the clot. Abnormal or delayed liquefaction of clotted semen may cause complete or partial immobilization of the sperm, thereby inhibiting their movement through the cervix of the uterus. After passing through the uterus to the uterine tubes, the sperm are effectively affected by secretions of the uterine tube in a process called capacitation. Now, sometimes it is observed the presence of a blood in the semen is called hemiospermia. In most cases, it is caused by the inflammation of the blood vessel lining and seminal vesicle. It is usually treated with antibiotics. Now there are some supporting structures present in the male reproductive system. पेनिस, जिसको आयुर्वेद में ध्वज कहा गया है, मेंढर कहा गया है. The penis is a supporting structure of male reproductive system that contains urethra and is a passageway for ejaculation of the sperm and excretion of the urine. It is cylindrical in shape and consists of body, glass penis and a root. A smaller mid-ventricle mass, corpus spongiosum penis, contains spongy urethra and keep it open during the ejaculation. Skin and subcutaneous layer enclose all three masses, which consist of the erectile tissue. Erectile tissue composed of the numerous blood sinuses lined by the endothelial cells and surrounded by the smooth muscles and elastic connective tissue. The distal end of the corpus spongiosum penis is slightly enlarged and a cone-shaped region called glans penis. Its margin is the corona. The distal urethra enlarges within the glans penis and forms a terminal slide-like opening, external urethral orifice, covering the glans. An uncircumcised penis is loosely fitting the prepuce or foreskin. The root of the penis is attached portion. It consists of the bulb of the penis and expanded posteriorly, continuation of the base of the corpus spongiosum penis and the crura of the penis, the two separated and tapered continuation of the corpora cavernosa penis. The bulb of the penis is attached to the inferior surface of the deep muscles of perineum and is enclosed by the bulbospongious muscle. Contraction and of the bulbospongious muscle aids ejaculation. Upon sexual stimulation, that means visual, tactile, auditory, olfactory or imaging, parasympathetic fibers from the sacral portion of the spinal cord initiate and maintain an erection, the enlargement and stiffening of the penis. The parasympathetic fibers produce and release the cause local production of the nitric oxide. The nitric oxide causes smooth muscles in the wall of the arterioles supplying erectile tissue to relax, which allow these blood vessels to dilate. This in turn cause large amount of blood to enter the erectile tissue of the penis. Nitric oxide also causes smooth muscle within the erectile tissue to relax, resulting in widening of the blood sinuses. The combination of increased blood flow and widening of the blood sinuses result in an erection. What is erection? Expansion of the blood sinuses also compresses veins that drain the penis. The slowing blood outflow help to maintain erection. Now ejaculation. What is ejaculation? The ejaculation is the powerful release of the semen from the urethra to the exterior. It is a sympathetic reflex coordinated by lumbar portion of the spinal cord. As part of the reflex, smooth muscle sphincter at the base of the urinary bladder closes. Therefore, urine is not expelled during ejaculation and semen does not normally enter the urinary bladder. So this is about the male reproductive system. आप सबको ये याद रखना है कि आज हमने जो पढ़ा है उसमें डक्ट सिस्टम के 3 पार्ट होते हैं, एपिडिडिमाइज, डक्टस डिफरेंस और वास डिफरेंस और इजैकुलेटरी डक्ट। तो पहले ही जो डक्ट होते हैं वो टेस्टिस में होते हैं, वहाँ से अपना स्पर्म जो है वो एपिडिडिमाइज में आ जाता है। एपिडिडिमाइज में फिर कुछ समय तक वो वहीं पर स्टोर किया जाता है, उसकी वजह से स्पर्म में मोटिलिटी आ जाती है, उसकी वजह से वो एक ओवम को फर्टिलाइज कर सकता है, सेकेंडरी oocyte को फर्टिलाइज कर सकता है। उसके बाद में नेक्स्ट पार्ट है वास डिफरेंस, इसी को डक्टस डिफरेंस ऐसा भी कहते हैं। इनमें से भी स्पर्म का ट्रांसपोर्टेशन हो जाता है और यहाँ से स्पर्म आगे की तरफ चले जाते हैं। उसके बाद में है इजैकुलेटरी डक्ट अगना। इजैकुलेटरी डक्ट में से भी स्पर्म आगे आगे चले जाते हैं। तो ये सब पोर्शन और नेक्स्ट पार्ट इज यूरेथ्रा, जिसके 3 पार्ट है, प्रोस्टेटिक यूरेथ्रा, मेम्ब्रेनियस यूरेथ्रा और स्पॉन्जी यूरेथ्रा। तो यूरेथ्रा जो बेसिकली है वो सीमेन और यूरिन, ये दोनों इसका एक ही रास्ता है। यूरेथ्रा के बाद स्पर्मेटिकॉर्ड, इसका भी रोल है, सपोर्टिंग स्ट्रक्चर इसको कह सकते हैं हम। 3 प्रकार की एक्सेसरी सेक्स ग्लैंड मेल में होती है, सेमिनल वेसिकल, प्रोस्टेट ग्लैंड और बल्बो यूरेथ्रल ग्लैंड। उसमें सेमिनल वेसिकल में से जो फ्लूइड आती है वो अल्कलाइन नेचर की होती है। अगर वो नहीं आए तो एसिडिक एनवायरनमेंट की वजह से शायद स्पर्म किल हो जाएंगे, तो वो टाला जाता है। इसी में प्रोस्टाग्लैंडिन भी होता है जो स्पर्म की मोटिलिटी और वाइबिलिटी बनाए रखता है। क्लॉटिंग प्रोटीन भी इसके अंदर होते हैं। टोटली सेमिनल वेसिकल का फ्लूइड जो है वो 60% ऑफ सीमेन का तैयार हो जाता है। उसके बाद एक प्रोस्टेट ग्लैंड है। प्रोस्टेट ग्लैंड की साइज 4 सेंटीमीटर, 3 सेंटीमीटर और 2 सेंटीमीटर होती है। क्योंकि बहुत वृद्ध व्यक्तियों में ये प्रोस्टेटाइटिस का तकलीफ होती है, उसमें प्रोस्टेट ग्लैंड की साइज बढ़ जाती है। उसमें भी अलग अलग प्रकार के फ्लूइड होते हैं। प्रोस्टेटिक फ्लूइड थोड़ा सा एसिडिक फ्लूइड होता है, उसमें साइट्रिक एसिड होता है, एटीपी प्रोडक्शन में यूज आता है। प्रोस्टेट स्पेसिफिक एंटीजन होती हैं जो प्रोस्टेटाइटिस में, अगर ये प्रोस्टेटाइटिस कैंसर की वजह से बढ़ रहा है तो उसमें प्रोस्टेट स्पेसिफिक एंटीजन का प्रमाण भी बढ़ जाता है। आप देखेंगे 25% ऑफ द वॉल्यूम ऑफ सीमेन जो है वो प्रोस्टेटिक ग्लैंड की फ्लूइड की वजह से होता है। उसमें बल्बोयूरेथ्रल ग्लैंड, ये तीसरी प्रकार की ग्लैंड होती है, वहाँ पर से भी बहुत सारे सिक्रेशंस ये सीमेन में आ जाता है। ये 3 ग्लैंड का सिक्रेशन प्लस स्पर्म, इसकी वजह से हमारा सीमेन तैयार होता है, जिसको शुक्र धातु कहते हैं। उसका वॉल्यूम 2.5 से 5 ml होता है, उसमें 50 to 150 मिलियन स्पर्म होते हैं। इसकी संख्या अगर 20 मिलियन से कम हो जाए तो इनफर्टिलिटी हो जाती है, या इनफर्टाइल कपल में बहुत बार मेल में यह नजर आता है। सीमेन की पीएच जो है 7.2 to 7.7, यह अल्कलाइन है। प्रोस्टेटिक सिक्रेशन की वजह से मिल्की अपीयरेंस आता है, और सेमिनल वेसिकल और बल्बोयूरेथ्रल ग्लैंड की वजह से स्टिकी कंसिस्टेंसी, मृष्णता इसमें आ जाती है। उसके बाद में सीमेन जब हम जमा करते हैं तो 10 या 20 मिनट के बाद पहले तो वो कोआगुलेट हो जाता है, उसके बाद में फिर 10 या 20 मिनट के बाद वो रीलिक्विफाई होता है, क्योंकि प्रोस्टेट स्पेसिफिक एंटीजन उसको रीलिक्विफाई करता है। इसका संबंध भी इनफर्टिलिटी से देखा गया है। अगर सीमेन में ब्लड हो तो ये तो हीमोस्पर्मिया कहते हैं। सपोर्टिंग स्ट्रक्चर में पेनिस है। पेनिस का एक महत्व का कार्य है, वो है इरेक्शन। तो इरेक्शन में जो है हमारा पेनिस जो है उसमें स्टिफनिंग हो जाती है और एनलार्जमेंट हो जाती है। उसमें नाइट्रिक ऑक्साइड का रोल बहुत इंपॉर्टेंट होता है। अगर ये नाइट्रिक ऑक्साइड कम हो जाए तो ये इरेक्शन ठीक तरह से नहीं होगा। इसके बाद में हमने देखा इजैकुलेशन। ये सब हमें याद रखना है, समझ के लेना है। थैंक यू वेरी मच।